It's not an inconsequential amount of money to treat a horse with Cushing's disease, especially if the horse is young. This disease isn't going to go away. It's a progressive degenerative disease, so you will be committing to treat the horse for life. And very ballpark figures, and I don't want to upset people here because you're going to say that my horse costs less, my horse costs more, but horses are different sizes, they need different doses. So we're talking roughly about £1 just over a day for pergolide. And yes, that's a lot of money if you add that up over a period of time, but if you compare that to the cost of laminitis, which is 4 times more likely to happen in a horse that's got Cushing's disease than a horse that hasn't, it's very easy. And again, ballpark figures, so please don't write in if they're slightly different to your own vet's fees. But we're talking approximate fees here for a few vet visits, corrective farrier for a few examinations, for some painkillers, for some foot supports. For some x-rays if the case isn't resolving quickly, and x-rays are always useful to assess severity, you can very clearly exceed the amount of money that you would have spent on pergolide. And I'm not saying that pergolide is going to prevent every case of laminitis, but it's a very effective drug and it does a huge amount to reduce the likelihood of disease. So you factor into that what it costs you to keep a horse normally anyway, and the fact that if the horse has laminitis, you can't do what you want to do with it. And you also factor in the pain and the stress, not only to your horse but also to you, of seeing your companion in a lot of pain and so on. Then I do think it can be a tough decision what to do. But I would certainly suggest that the benefits of treating do outweigh the risks if there is a history of laminitis.